SUNY Downstate Community Women's Health is a group within the Obstetrics and Gynecology Department focused on bringing information and resources to the community that we serve. We aim to reach you where you are.
We embrace the vibrant diversity of our community, and we put together programs based on what you tell us you need to know and how we can best help.
If there's a topic, a question that you want us to talk about, or a place, maybe a group or a church that you want us to connect with, let us know. You can email us at womenshealth@downstate.edu, and that's WOMENSHEALTH, womenshealth@downstate.edu.
We thank our patients and community partners that help us to best reach you.
Thank you.
Gracias.
Merci un peu.
Merci beaucoup.
Hi, hello everyone. This is Denise Lois, a lactation consultant at SUNY Downstate, and we are here to tell you why your baby needs your breast milk and why you should breastfeed, because it's a food of choice for your baby. With me here is...
I'm Dina Rudnitsky. I'm lactation consultant and a nurse from neonatal ICU unit, and I'm here also to promote breastfeeding in our community. Why breastfeeding is very important for the baby? First of all, it can help to reduce infections as ear infection, as lung infection, viral infection, and will promote baby health in general, as well as can reduce allergies and risk of asthma and obesity in children.
For the mom, there are lots of benefits for the mom, but we'll just mention a few, such as reduce mom's chance of breast cancer and ovarian cancer. Also, it can help her to get back into a pre-pregnancy weight sooner. It's cheaper. She doesn't have to spend much for that breast milk. And it is convenient. It's readily available for the baby. It's safe for the environment. Less dispose of bottles or other things. So how do we breastfeed?
So we promote exclusive breastfeeding because we believe that the babies that breastfed exclusively get much better benefits than the babies that fed with formula or supplied with formula. As well, exclusive breastfeeding helps mom to get adequate milk supply and avoid many complications with breastfeeding that we're going to talk later.
So starting out to breastfeed, one always think of how does the baby get the milk. Once a mom picks her baby up and places the baby to her breast, that baby's mouth and the mother's breast send the message to the brain, hey, release these hormones that can help baby to get the milk. Hormones such as oxytocin and prolactin. So the prolactin hormone is the hormone that increases the breast milk. Oxytocin, the hormone that helps mom to release the breast milk. And that is the feedback from the baby. As the baby latches onto the breast, the feedback is release of oxytocin and prolactin. Getting the baby correctly onto the breast is very important. We call that the latch. The latch is when the baby grabs the breast with his mouth, with a wide open mouth, onto the nipple areola. In this diagram, you will notice at A, how well the baby is placed at the breast. Lips are wide apart. Much of the areola is in the baby's mouth. B shows you how far back the nipple reaches into the baby's mouth. And it gives you a little diagram of your milk ducts inside your breast, because you usually don't see your milk ducts. C shows you when the baby is hardly onto the breast. It's just at the nipple. And when the baby is just at the nipple, there is no milk flowing to the baby or very, very little. On the opposite diagram, you see how well your baby has to have a wide open mouth. So when the baby's open the mouth wide, you bring the baby onto the breast and helps the baby to grab much more than just the nipple. Always hold your baby close.
When we want to start breastfeeding, we would like to start breastfeeding as soon as the baby born, or at least during the first hour. And we want to watch the baby feeding cues and feed on demand. Now Ms. Lewis is going to talk about baby cues.
Feeding cues is when the baby's telling you, hey mom, I'm hungry. Baby gives you many signs before they start crying. And we do not want to use crying as the first sign to pick the baby up for feeding. So, baby wakes out of a sleep, that's a cue. Baby starts smacking his lips, that's a cue. Baby sticking their tongue out or carrying their hands to their mouth, turning their heads rapidly from side to side, those are signs that says, Mommy, feed me.
As soon after birth, we would like baby to have skin to skin with mommy in the delivery room. What does it mean, skin to skin? Skin to skin means that the naked baby will be placed directly on your chest, on your tummy. Why it's good? It's good for the first bonding. It's good for the baby to maintain temperature. It's good so the breastfeeding start. Baby can be latched on immediately upon the birth, and it just promotes the first bonding. Now we're going to talk if mom and baby get separated at birth and the baby was taken to neonatal ICU unit for any reason. We would like mommy to start express milk within 6 hours after delivery and bring it to the neonatal ICU. How mom's supposed to express breast milk? She will massage and hand express milk to stimulate milk increase and express milk 8 to 10 times in 24 hours. And especially if she can do it one time at night will be very helpful and benefit the baby. And when mom collects colostrum for the baby, she will bring it to the NICU. And if baby will be allowed, baby will get colostrum as soon as possible after the birth.
So let me walk you through hand expression. Hand expression is best start as soon as you deliver. And for the mom whose baby may be separated from her at birth, it's best start within the first hour or within the first 6 hours after birth. If the mom baby is at your bedside, you can do it at any time after delivery. How do we do hand expression? We first start with clean hands. Wash our hands clean. Then we start with massaging the breast. Massaging the breast is very important because it stimulates the release of colostrum. You massage up from the chest, upper chest, down to the nipple. So as you're massaging from up chest slowly down to your nipple, and you massage all around, not just in one area, because we do have milk ducts all around the breast. So we're going to go all around to massage and to stimulate the release of colostrum from those glands. You may also find yourself playing with the nipple a little, because playing with the nipple still helps your body to release that oxytocin. We talked about that oxytocin before. It helps to release the oxytocin that pushes your milk down. And after you've done that massage, which may take about a minute to 2, you'll use your thumb and the forefinger. These are the 2 fingers that are in play when you're hand expressing. You place them around the areola, push back into the chest wall, compress, you bring them together, and you release. You're not lifting them off the breast. Push back, compress, release, compress, release, compress, release. You're sort of imitating a baby suck at the breast. So push back, compress, release. You will move your hand around, because you need to move your hand around the breast so that you can drain the other milk ducts that have milk. In the beginning, it takes a little while before you can see that colostrum flow. Colostrum is very thick and sticky, and it doesn't really flow out very fast. So be patient. Take a deep breath, relax, and you do that. How you collect the colostrum? You may get a spoon or a small medicine cup, and you place it close onto your nipple, and you collect that colostrum. If your baby is separated from you, using a machine helps also to bring that milk out to take to your baby. If you're going back to work after a few weeks, you having a breast pump machine also is very useful. How do you use a breast pump? How do you use the breast pump? While you're in a hospital, you use it 8 to 10 times within a 24-hour, as Dina has said to you before. Make sure that you place the nipple well placed into the flange. It should cover the areola, not away. It should compress, make a tight seal, and as the pump is moving, you will see your nipple moving towards the flange. It should not be painful. Never pump with pain. Complication that can arise when you're breastfeeding. And there are some complications that can arise, such as sore nipple or bruised nipple, and that can happen when the baby does not latch correctly to the breast. So our goal is to make sure that the baby latch correctly. Also, we want to make sure that you're holding your baby well to help the baby to latch correctly. So holding the baby to the breast means that the baby must be in a straight position, tummy to tummy, as a nurse said, nipple to nose. So always when the baby is going to the breast, make sure that your nipple is pointing to the baby's nose, and allow the baby to open up wide and hold the baby close to you, not away from you. Away from you means that the baby is not going to be able to maintain a good latch. We want to have the baby closer. The baby buttock should be over towards the other breast, the breast that the baby is not on, and the baby head should be slightly tilted back so the baby can suck well, not create pressure on your nipple. The other complication is plug ducts. Plug ducts happens when the baby doesn't drain that breast well, or mom is wearing a tight-fitting clothing, such as underwire bra or anything that prevents the milk from draining well when she's nursing. If the plug duct stays for a while, it can lead to mastitis. And mastitis happens when that area is inflamed. What mom should do is to go to her doctor, consult her doctor, to check it out, to see what's happening. Rest is very important when this happens. Fluid is very important. Emptying the breast is very important. Don't stop breastfeeding, because this is when you really need to do it well. And whatever medication the doctor gave to you, if you need that, please take it. I've always had this question asked: what should I eat when I'm breastfeeding? Is there any food to avoid when breastfeeding? What we say is to have a variety of food. Eat everything that is before you. There's no food that we can say to you at this time to avoid, except alcohol. We don't want you to drink alcohol when you're breastfeeding. We want you to avoid smoking. We want you to not to use any illegal drugs. But when it comes to your diet, variety of food is very important, because you'll get the nutrients that you need for your body to maintain a strong energy, healthy body, healthy baby. Also, drink to thirst. You do not drink water to make milk, but you need to drink water to keep you well hydrated. And so whenever you're sitting down to breastfeed, if you're not someone who drink water well or often, sit with a glass of water at your table next to you when you're breastfeeding. Take a mug of water to the room at night when you're going to bed, so that it helps you that you don't have to get up all the time and to go and look for that water. But drinking is very important. And your diet. Do not skip meals. When a woman is breastfeeding, especially if she's exclusively breastfeeding, we do not want her to miss a meal. And have snacks. Snack in between is good when you're breastfeeding.
Formula feeding and breastfeeding will lead to the decreased milk supply in mom. And a baby also might refuse the breast because of the nipple confusion, because the bottle has different nipple on it and the mom has different nipple. So it might be a problem with latching on. Also, it can lead to increased risk of allergies. I'm going to talk about COVID precautions. Now, during the pandemic, we would like to talk about CDC guidelines. CDC current guidelines about COVID precautions always to practice good hand washing before and after the handling the baby, and breastfeeding and pumping. Also, avoid any outings. Stay home in safe environment. Don't go out, don't take baby out. And we don't want you to expose the baby to anybody who can be COVID positive and you still don't know about it. As well, if you suspect that you're getting sick or you were exposed to COVID positive person, contact your doctor immediately. And with your doctor, you will discuss whether you continue breastfeeding or what will be decision made. Discontinue or continue, it will be your decision with your doctor together. But anyway, if you're expressing the milk, wear the mask, always clean and disinfect all the parts of the pump from inside to outside according to manufacturer. Everything should be cleaned. And if you're using the sanitizer, the CDC guidelines is saying that it should be not less than 60%. And always contact your doctor about any concern regarding COVID-19, any questions, because the guidelines keep changing, and to get the recent updates, you need to talk to your doctor.
That's the end of our presentation. We are here to support our mom to breastfeed anytime, anywhere. We can all help by giving mom that thumbs up when she's breastfeeding.